I think that there's this very huge power to be able to listen to these stories for your own personal enrichment.
Having a project like this where people can like find out about it and learn what an oral history is going to be very valuable.
What attracted me to the oral history was being able to engage deeper in storytelling in the context of health.
I tell everyone that doing this internship was the best decision of my life. I think so. Actually, for some context, this summer I was studying for the MCAT. And so I was looking for something that would give me a break from science and a break of all of that nitty gritty, like scientific things. And this experience has been such an amazing break from that because it really provides the big picture. And I think that when I talk about it with my friends, the first thing that I say is like, I see who I want to be in these people.
I think my conception of global health changed in that I was able to hear from these people and watch interviews that Asna and Maylis did, um, where these things were very, very immediate. And human rights was and global health were no longer things that you read in a textbook or you scanned the convention before class because they're going to talk about it that day. Like it was, oh, we actually used the right to private family life in a case at the European court.
If I think back to the moment that really hooked me, that's going to be the second interview with Michelle. That, whew, looking back on all the oral histories, that's definitely even the one that sticks out to me the most. When I logged off that interview or that oral history, I distinctly remember thinking to myself, like, wow, my life has just changed, a little dramatic, but like I was so just in awe. Just the way she spoke, she had this very like gentle, fluid way of speaking. And I felt like I could just listen to her forever. I felt almost elated, there was a joy in listening to her. And I think that, it wasn't just the way she spoke, it was her view on the world, the way she like in everything she did, all her work, you could see this clear love for humanity that she had that, she didn't care about people for what they can give to the world, but just because they are part of the world. And everything she did was to help improve others' lives.
I had started studying global health my freshman year or my sophomore year, I forget. Um, so it's been like a few years since I've like really become very interested and passionate about global health. And I think in that time, it's been a lot of bad news. Um, I mean, half of my college experience was like defined by a pandemic where like it felt like nothing was going right. So to me, it felt like global health, like what was I going to do in global health, in public health? You know what I mean? I had sort of lost a lot of the passion and sort of like the bright eyes experience that I had gotten when I first started studying it. And literally just this whole project really, but like I find the really defining moment as that interview with Sarah because I was just like completely blown away and it felt like I was like rejuvenated with passion for what I was going to do for like the like foreseeable future. Um and like to explain a little bit what like shifting my life looked like, really like obviously for me I'm 22, so shifting my life, you know, like my whole life has shifted. My life has shifted every day. But I I'm doing research using the collection um on harm reduction. I plan to go into a job in like providing harm reduction services after I graduate in December. So it feels like a huge shift to me and I think it's due to people like Misha and Sarah. But it was really that moment in the interview with Sarah where I was like my head exploded.
I think that when I was learning about harm reduction and I was realizing that, okay, people who use drugs are at risk of so many other things when they're not given access to clean syringes or to the proper care they need for when they're using. It is a much bigger issue than if you provide them safe using centers and if you provide them with clean syringes, clean needles, and proper sanitation. And so I had to take a step back and I had to think to myself, okay, what were my opinions before? And how do I look at this issue after having this experience? And I realized that George Soros and this entire OSF kind of work on harm reduction was something that had completely not been in my mind before.
The first one that comes to mind, I keep bringing back these people, and literally every one of them contributed to my conception of human rights. But there's one sort of quote from Sarah that I recall, which is what does human rights mean? What do human rights mean in the context of harm reduction? It means literally having the right to live and to take up space. As someone who uses drugs, taking people as they are and not having any strings attached to the dignity that you give them. That was a moment where it really clicked for me.
I think the biggest thing that changed was, I guess how I ask questions. I think coming from medical school, being in medical school, we're taught to find answers when it comes to the questions that we ask. Do you have shortness of breath or do you not? There's a right or wrong answer a lot of the times. And then kind of having to switch mindsets. And it's now you're asking questions that don't have a right or wrong answer. You're trying to ask questions to help people express themselves, to help them, maybe dig up some memories they may have forgotten, help them put meaning to all of their events and their work of their life as they reflect back. And so, yeah, that was definitely, I think, the biggest way that changed.
I always used to do public speaking and I always used to do debate. So I was always the one who was talking and I was never the person who was listening. And now I'm in this position where I'm literally listening to people and they'll be 3 hours. Who are you listening to for 3 hours? And I'm you won't believe me, but it's it goes by so quick. I have no problem with 3 hours. These people are incredible.
The other story that I can think of as a moment that just really stuck out to me was when I was interviewing Grace Kamal, who is the regional director of this organization called the African Sex Workers Alliance. And it was when she was talking about these academies that they would do. And they were just working on building the capacity of sex workers so that they could organize for themselves and defend themselves against unjust laws and unjust people. And I was take me back to that. What would I have seen if I was able to go to the academy myself? And she just painted such an optimistic, collaborative, fun environment. And I could just see on her face, she was so fond of those memories.
This isn't something we're taught in our medical education and trying to become a doctor. Even if we have a health justice systems of care course where we go over how race affects health, how, access to parks or how zoning law, I don't know, how all these different factors work, social determinants of health. We learn about that, but we don't learn about how rights affects health, what a rights-based approach to health is, even that was so very much fit into that, the topic of that course. And so I guess one way I see, it impacting at least, practice of medicine or just kind of medical school in general is maybe a way to incorporate that into curriculum.
For me, I learned so much, and I cannot emphasize how much this project has enriched my own experiences and enriched my own understandings. It's been absolutely phenomenal to be able to explore these issues from a firsthand story that someone is providing. And I think that, at least from the experiences that I've heard from global health or public health or in related fields, a lot of it is papers and a lot of it is textbooks. And it's very rare that a student can have the opportunity to talk to someone who is so well versed in like any public health issue. And I think that it's so important to have students be able to learn from this experience as well. Not only that, but also some of the researchers who are going to be doing research on this archive will be students. And so having a student conduct the interview might be more conducive to having questions that are asked that another student who's a researcher might ask themselves.